Imagine a situation where every second counts, where a profound medical diagnosis can not only bring clarity to a family but also offer a second chance at life for others. It is a moment of immense gravity and responsibility, requiring the utmost precision and ethical care. Brain death is ethically confirmed for organ procurement through a rigorous multi-step medical process that establishes the irreversible cessation of all functions of the entire brain, including the brain stem. This confirmation must adhere to strict medical and legal criteria, ensuring there is no uncertainty about the patient's condition. The primary reason for such a stringent process is that brain death is legally and ethically recognized as the death of the individual, meaning the person has died. This definition allows for organ donation to proceed because, although mechanical ventilation may sustain heartbeat and respiration, the individual is no longer alive. This certainty is vital to uphold the dignity of the deceased and the trust of donor families and the public. The standard for this determination aligns with the Uniform Determination of Death Act, or UDDA, which is a model law adopted in many United States jurisdictions, clearly defining death as either irreversible cessation of circulatory and respiratory functions or irreversible cessation of all functions of the entire brain, including the brainstem. To ethically confirm brain death, a detailed clinical examination is performed by at least two qualified physicians who are not part of the transplant team. This examination looks for the complete absence of brainstem reflexes, such as pupillary response to light, corneal reflex, gag reflex, and cough reflex. It also checks for the absence of motor response to pain and the absence of spontaneous breathing, which is confirmed by an apnea test. Furthermore, doctors must rule out any reversible conditions that might mimic brain death, such as severe hypothermia, shock, or the effects of sedatives and paralytic medications. In some cases, confirmatory tests like an electroencephalogram, or EEG, or cerebral angiography may be used to further demonstrate the absence of brain activity or blood flow to the brain, adding an extra layer of certainty. A key ethical safeguard in this process is the mandatory separation of clinical care from organ procurement. The physicians determining brain death must be independent of the organ recovery team, preventing any perceived conflict of interest. This ensures that the primary focus remains solely on the accurate and unbiased diagnosis of death. Additionally, families are provided with clear, empathetic explanations throughout the process, ensuring their understanding and respecting their emotional needs during this difficult time. Ultimately, the meticulous and independently verified confirmation of brain death provides the foundational ethical assurance that organ donation proceeds only after a person has definitively passed away. This steadfast commitment to accuracy and transparency supports the integrity of the donation system, honoring the donor and giving profound hope to those awaiting life-saving transplants.